And so our team is working right now on some additional guidance to long-term care facilities to give that exact answer. We want folks to do more proactive testing in our long-term care facilities. We're still working out the exact details in terms of how often does that mean. So if you test everyone today, that is just a moment in time. What is the next interval of time in which you need to test again? I think those are the details we're still working out, but I would encourage, and we're going to be asking the nursing homes to come forward with a plan on how do they intend to carry out that testing, both for their patients and others, and then what do folks need in other long-term care settings from the state in order to make that possible. So you're asking exactly the right questions, and it sounds like Buncombe is already moving in the right direction, which is to get to testing more in our long-term care facilities. The question is how often, and that we're still looking at the science and want to be able to make some recommendation. I know our testing surge work group and the scientists there have been looking at this exact question, and we hope to be able to give more guidance on that. But I would say lean in and do more testing of folks is sort of the guidance we're giving. And that's why we are signaling to clinicians today with this new guidance to say, testing more in these populations is really important. Thank you.
Our next question is from Kate Martin with Carolina Public Press.
Hello, Dr. Cohen. This is Kate Martin with Carolina Public Press. I want to ask specifically about inmates at state prisons. Compared to other states, North Carolina is testing a smaller than average percentage of inmates, and about a third of our prisons have yet to test a single inmate. For example, Michigan, which has a similar inmate population, they've tested 16,000 inmates, about 12 times what we have tested. Do you see any need to increase the testing of inmates? Also, why isn't North Carolina releasing more data on COVID in our prisons, such as the asymptomatic versus symptomatic cases, hospitalizations, demographic data, or testing for people on community supervision? I heard what you said about people who live in these settings need to get tested more, but prisoners also have to pay a copay just to see a doctor. And I'm wondering how you're going to test everybody with that in place.
Kate, thanks for bringing that up. I think, as you know, that the folks who run our correctional facilities in the state announced yesterday about a comprehensive testing plan for the staff. And we know that is the way in which virus can potentially enter the prison and correctional facilities. So I think good to prioritize the testing of our workers there, because these are the ones who are coming in and out. So that is a great first step forward. What we have been doing, I know, in terms of protocol since we've gotten to this point, is to say if there is an outbreak, again, 2 or more cases, that is when we do additional testing. And the good news is that we haven't seen other outbreaks in other facilities. And so when you're doing testing based on an outbreak, I think that is the concern. I think what you're going to see as we ramp up testing of our staff, we know we're going to find more virus potentially. Then we'll trace back to where are those staff? Are they in one of these correctional facilities that has not yet undergone more testing? And then we will take the necessary steps from a contact tracing perspective to ramp up testing. I'm not as close to the details on the data side for our correctional facilities, but I will have our folks from the Department of Public Safety follow up on how they are doing data collection there. I know data collection, I will just say, outside of that space is a very manual process, unfortunately, as we work to try to routinize and automate some of that data collection. So I know it's a challenge on that side. I can't speak exactly to the data collection issues in the correctional and public safety space, but we'll have some folks follow back up with you on the data piece.
Our final question today will be